We know a lot about the molecular characterization of bladder cancer, but not as much about the upper tract. And so a lot of the clinical pathologic staging and risk stratification of upper tract is based on tumor stage and grade, but we don't have really great ways to prognosticate and risk stratify those patients to determine who would do best with what therapies. So we looked at 100 upper tract tumors from 100 different patients, and we subjected all these tumors to bulk RNA sequencing, and then after that we put them through a consensus clustering analysis. So it made these patients fall into 5 different cohorts. Each of these had kind of different characteristics, which showed us the upper tract tumors are very heterogeneous. Some of the groups had worse recurrence, free survival, and worse overall outcomes, and other ones had better, and usually it was the ones that had higher stage and grade and those that had higher recurrence rates. But then when we looked a little bit deeper, we found certain characteristics that kind of define these clusters. So C1 and C2, which were the ones that had the worst prognoses, we found that these were particularly inflamed, so a lot of gene signatures associated with inflammation. And C2 and C3 also had a lot of CD8 T cells that we found in these populations. So right now, it helps us kind of have a little bit better idea of what's going on in these tumors, which is hypothesis generating for the future of what kind of therapies might help treat these kind of tumors. So maybe immunotherapy would work better in certain patients that have more of a response to that, while other patients who might have more of an immune desert in their tumors, maybe they don't respond as well. So it's a lot of work that we've done so far to characterize these tumors, but it's more the work in the future to see how we can actually treat them better.